I'm going to be covering 3 nerve flosses that we often give for any individuals who are having some sort of numbness, tingling, weakness going down the arm into the hands and fingers. Now, this can just be from points onwards, or it can be starting from the neck. So we're going to go over the radial, our median, and our ulnar nerve. And those are the 3 branches that come from our brachial plexus here. So my rule of thumb whenever I'm doing this is that whenever my hand is near my head, I'm always going to tilt away. We're going to try to look at it as if the magnets, when you do the wrong sides, try to always push away from each other. That's the same exact reaction I'm kind of wanting here. And then when I open up my hand and extend my arm, I'm going to then tilt that way. So I never want to maximally stretch it like this. There are some videos where they do that. I prefer not to, because I like to look at it as our nerves, when they come out of the base of our head and go to our fingertips, we're essentially legit flossing and pulling back and forth. So if there is any sort of muscle adhesions, fascial entrapments, or anything compressing it, this will help kind of break it off and release the nerve itself. So starting with the radial nerve, we're going to take a waiter's hand position as if we're serving a tray or platter. So again, my hand is here. I'm going to tilt away. I'm not trying to shrug my shoulder to my head here. I'm just tilting my head to the side, waiter tray here. And then when I come to undo my hand, it's going to rotate. So my palm is going to try to face backwards. And if you can flip it all the way, so the thumb and palm are up towards the ceiling now, and bring it slightly behind, I'm now going to tilt towards this side. I'm going to come back, tilt away, waiter position, twist, and then tilt towards that side. Now the radial nerve does spiral. That's why there's a lot of rotation and twisting here. So it spirals, and if you get a lot of any neurological symptoms running down the back side here, that is our indication of the radial. Our median nerve tends to run more on the anterior aspect of our hand, and usually this side of the fingers and digits. So with that one, this one's a lot simpler, where we just fingers tap the shoulder, tilt away, undo the hand, make sure I try to open up as much as possible, and then tilt again towards the hand here. Back towards the shoulder, back this way. And then lastly, our ulnar nerve, which goes on the inside of our arm and to these outside of or inside of these fingers here. So with this one, we're going to make an OK sign. We're going to flip the palm so my pinky is trying to touch my ear. Not this way, but palm side up. Same thing, tilt away. And if you can get the arm up higher, the better. But if you're only right here, it'll be just as fine. And then same thing, gonna untwist, undo, and then the hand's gonna open back up, kind of like the median nerve. And then I'm gonna tilt my head again that way. Okay sign as I come back, pinky side up, and back and open. Typically, I like to do these and give my patients these prescriptions for only once a day for 10 reps. Now, it is normal to have symptoms arise, and they should only last about 10-15 minutes. If they exceed and are lasting about 30 minutes, then we just kind of irritated the nerve a little too much, and it's best to decrease it and maybe start around 5 reps, and then work our way up to 8 and 10. But just once out of the day will be enough. If you do too much of this, it can irritate the nerve even more and exacerbate the symptoms. So.